This lecture is looking at bone injuries. So we're going to start with fractures. And fractures are simply a synonym for any kind of break in a bone. So it can break, there can be chips off, there can be cracks that don't actually separate the bone, but those are all considered different types of fractures. There are some examples in the pictures down below, a couple of different arm fractures and a leg fracture. Typically, fractures happen when some kind of force is too much for the bone to sustain. So maybe somebody jumps off a high step or something and there's too much force in the landing. It can be from force exerted from the side or back. All kinds of different forces can cause injury. So here we're going to look at some of the different types of fractures. So a transverse fracture, seen here in number 1, is a horizontal fracture. So the bone breaks all the way across on a straight horizontal plane. A linear is just the opposite, so it's a vertical break down the length of the bone. An oblique fracture is basically a diagonal break, and if it pulls the bone out of alignment, if you have two separate chunks, that's usually called a displaced fracture. Whereas if the bone stays in position, even though it is now broken, it would be called a non-displaced. The alignment of the bone has not been displaced. Type 4 is a spiral fracture, and that's caused usually by a bone being twisted. So these kinds of injuries happen a lot in small children when a parent will be holding the child's hand and maybe the child falls or something and kind of twists as they fall, and that can break the bone of the arm. Number 5 is also most common in children. It's called a green stick fracture. And this is where you just get a little bit of a chip on the side of the bone, but there's not a break all the way through the bone. That happens, the reason it's called a green stick is it's similar to when young trees are growing and you try to break a branch and it will just bend or slightly crack because the wood tissue inside is still really flexible. Children's bones are similar, still flexible on the inside. And then the last fracture is called a comminuted fracture, which basically means that the bone has shattered in one or more places. Any of the bone types from the last slide can also break the skin. So if one of the chunks or more than one of the chunks of broken bone goes through the skin, that is called an open fracture. So you can see that here in this slide, this picture here, where the jagged piece of the bone at the end of the arrow is going through the skin. In the picture on the left, however, we have breaks at each of these sites, but you can see on the x-ray that the skin is still intact. So those are considered closed fractures. So once the type of fracture has been identified, there are lots of different ways it can be treated depending on how severe the injury is, how old the person is, and then there's a lot of variety depending on the actual location of the injury. So the most common treatment is one that I'm sure you've at least seen if you haven't experienced, and that's casting, which you can see here with the little gentleman in the blue cast. So it's a plaster or fiberglass material that hardens, and it keeps the bones lined up so that they can't shift and move through the healing process. A splint is a similar structure. It's a little bit more flexible. So with hand fractures especially, there's a lot of swelling initially when the bones break. And as the swelling goes down, the bones can shift quite a bit. So this kind of a splint allows for it to be tightened as the swelling goes down so that the bones stay lined up. And there's not a lot of shifting of position as the swelling diminishes. In terms of surgery, there are lots of different ways that bones can be surgically repaired. This picture has 2 of the 3 in the list. So if you look at these arrows here, we can use what are called rods, and those get applied directly into the skin. Oh, that is absolutely not what I was trying to do. So the rods get applied into the bones under the skin, and they hold the bones in position. This picture is arrows showing you the direction those would go, but there aren't actually rods here. Down below, you can see a plate which is on the left-hand side of this break, and pins that are going into the bone to help hold it in place and to keep little fragments together so that they don't shift and move. One of the more extreme treatments is called traction, which you can see in this picture down here. So this requires a person, it's also called external fixation. So it requires the person to be bedridden for a period of time. It can be days to weeks. It's often in a hospital, although not always. And this is used when bones need to be kept in a very rigid position, and it's too possible for the position to shift if the patient is allowed to be up and moving. So what you'll see is there are actually screws, oftentimes into the bone, sometimes into a cast on the outside. And then those screws attach to tension wires, which are then weighted at one end. And it provides a very, very precise angle of bone placement, and it can be shifted and adjusted as the bone heals to better improve the patient's likelihood of not having problems in the future. And then obviously the most severe and significant treatment would be having to amputate if the bone is too far beyond repair. This graphic details the process of bone healing. So at the very beginning, we have a bone that has broken, and so you see the bleeding. That's forming a bruise, which is what the word hematoma means. This little graphic right here is showing you all the types of cells that would rush to that area to try to chomp up the dead blood and the clots that will form, and any bacteria or other things that might be there causing infection. And then after a couple of days, that bruising starts to reduce, the swelling starts to go down slightly, and by about the end of the first week, we're about here, what a little connective tissue called a callus, in this case it's a soft callus because it's cartilage tissue that has no major metals in it, and that soft callus basically forms kind of like a bone scab, and it holds the two sides of the bone together. Over time, that callus will fill with bone tissue and more minerals. And then by the end of about 2.5 or 3 weeks, you get a hard callus formed. So the swelling has gone down significantly, and now you get some hard tissue that is replacing the gap left behind by the break. And then at the end of about 6 or 7 weeks, that hard callus will start to break down, and eventually, it takes about a year for the hard callus to fully break down, but after about a year, that bone will be repaired and back to normal. Unfortunately, bones don't always heal right. There are a few different reasons for this. It could be that the bone wasn't properly aligned when it was casted or splinted. It could be that the person never got treatment, and so there was no way for the bone to line itself back up on its own. It could be that the bone just didn't heal properly for lots of other reasons. So the two pictures you see at the bottom here are examples of malunion and non-union. So malunion is when the bone does grow back together, but it doesn't grow back together in the right shape. So the alignment is off. So the hard callus forms, which holds the chunks together, but it isn't held together in the right line. A non-union is when that hard callus never forms, and so there is a permanent, or at that point, a permanent gap in the tissue. And that makes it, both of these actually make it extremely difficult to use the bone. There's a loss of mobility, which means that movement is much worse. It can cause the bone to be shortened or misshapen. It can cause infection. Having that bone tissue on the inside open to the rest of the body environment can cause all kinds of infections, and obviously it causes a great deal of pain. Some other common injuries to bones can come not from breaks, but just from use. So artificial joints are a surgical technique or an intervention used to replace part of a bone tissue at a joint where the bone has worn down or become damaged. This usually happens because the bones at that joint have been used a lot. So these are common in older people or people who do highly competitive sports and are using those joints at a much higher rate than other kind of typical people. The three most commonly replaced joints are the knee, the hip, and the shoulder, and there's some pictures down below of what that looks like. So they're just, part of the bone is removed. It's sawed off most of the time, and then a piece that fits into the bone canal is replaced in the same shape, and it allows for the joint to be used for decades longer. So the final two injuries we're going to talk about are due to connective tissue. So within the skeletal system, we've talked about bones, obviously, but there are also ligaments, tendons, cartilage, all present as well. So ligament injuries are very, very common. They usually are the result of ligaments being overstretched. They're not terribly elastic, so they don't stretch very well. And so they can be overstretched to the point of a strain, which is little small tears, or a full and complete tear where the ligament separates one side from the other. Some of the common locations for these are knee, elbow, shoulder, again, just like the replacements. And there are some specific examples there for you. The final injury type is cartilage injuries. So cartilage can be broken or overstretched or strained, just like bone and ligaments. Usually cartilage injuries are due to either a severe trauma, like getting, say, hit in the face with a ball, or something that has worn down over time. So articular cartilage, which you'll remember wraps around the ends of the long bone, it can easily be worn away by bones rubbing together. So knees, for example, often wear down the cartilage because the knee gets used so frequently over the course of a lifetime. There are other cartilage injuries like a broken nose or a strained or chipped ear cartilage. And no matter what kind of injury and no matter what caused it, cartilage and ligament injuries take a really, really long time to heal because there's not very good blood flow to those regions. Bones have great blood flow, but the connective tissue doesn't. So they take a lot longer to heal. So that's it for today. Write a couple of discussion questions, and I'll see you in class.